I'm Dr. Ian Alexander, owner of the National Sinus Institute and inventor of Simplicity Dilators. I have performed hundreds of in-office sinus dilations using multiple devices to perform the procedures. Many of them are expensive and complex to use. I wanted to invent something that was efficient, easy, and reusable. That's why we invented Simplicity Dilators. The Simplicity Dilator provides most patients with relief of sinus pressure, some within a few minutes after the procedure. Simplicity Dilators are both low risk and effective in patients of all ages with minimal recovery times. Many patients experience positive results immediately with long-lasting relief. Plus, the rates of success are similar to those of more complicated devices and procedures such as balloon sinuplasty. The first demonstration we'd like to do is of the maxillary sinus dilator. This is performed by entering the anterior portion of the nose, superior to the inferior turbinate. The middle turbinate has been reflected superiorly. The 2 mm sinus dilator is gently placed into the maxillary sinus behind the uncinate process. Once dilation is complete, the dilator is removed and a larger dilator may be used. I will now demonstrate the maxillary suction dilator. The 2 mm maxillary sinus suction dilator is passed into the nose and into the maxillary sinus. At the same time that it dilates, it also will suction out any mucus or debris from within the sinus. After dilation and suction, the sinus dilator is removed and a larger suction sinus dilator may be utilized. Next, I will demonstrate the use of the frontal sinus dilator. The frontal sinus dilator is entered into the anterior portion of the nose. The middle turbinate has been inflected superiorly. The dilator is then passed up into the frontal sinus to dilate the frontal sinus. Following this, the 2 mm dilator is then removed and a larger dilator may be used. Next, I will demonstrate the sphenoid sinus dilator. This is a 2 mm sphenoid sinus dilator. It is passed through the anterior portion of the nose, superior to the inferior turbinate, at approximately a 30-degree angle from the nasal floor. Following this, the sinus dilator is passed into the sphenoid sinus. Care is taken to not pass through all the way through the sphenoid sinus. There are 3 markings on the sphenoid sinus dilator at 7, 8, and 9 centimeters. We do not go past the 8 centimeter point. Following this, the sphenoid sinus dilator is removed and a larger dilator may be utilized. I will now demonstrate the use of the sphenoid sinus suction dilator. This is passed into the anterior portion of the nose above the inferior turbinate and directed towards the sphenoid sinus. There are 3 markings on the device to show you 7, 8, and 9 centimeters. Once the device is passed into 8 centimeters, the hole may be covered to suction in within the sphenoid sinus and the dilator may be removed. A larger dilator may also be used. Simplicity dilators are low cost and reusable. They have been found to pay for themselves in as few as 4 uses, as compared to non-reusable balloon sinuplasty systems. Simplicity dilators, fast, effective, and reusable. To learn more about how you can increase your profits on day 1, visit us at simplicitydevices.com.